In this video, we will explore OET Reading Part B. Stop thinking of OET Reading Part B as a reading test. That's the trap everyone falls into. Instead, think of it as a clinical detective game. You are not just reading, you are interrogating the text, filtering the noise, and prioritizing information like a real healthcare professional. Here is the secret nobody tells you. The test is more about how you think than what you read. If you get your thinking strategy right, the answers almost find themselves. Okay? So treat the text like a patient story. Of course, every text is like a case report or patient chart, right? It has some critical information such as medications, allergies, vitals, and some background noise such as personal information, irrelevant context. And here is your job to scan like a clinician. You need to prioritize what matters for patient care. Imagine you're holding a patient's chart. You don't read every word about their weekend walk, right? You have to look for red flags like allergies, current medication, symptoms. That's exactly how you approach part B. And try to see it using the information lenses. I'm going to give you the three lenses. The first one is detail lens, the second one is reasoning lens, and the third one is negation lens. The first one, of course, the detail lens, you have to look for the exact numbers, dates, medications, vitals, all these things. And the second one, reasoning lens, try to find out the cause and effect like symptom, diagnosis, all these things. And the third one is negation lens, words like not, except, no history of. So these are traps which you need to be aware of. Now put on one lens at a time. Don't try to mix them. It's like switching between X-ray, MRI, and lab reports. Each gives different insights, isn't it? And try to use the prediction before reading hack. Before scanning the text, try to read the question first and predict what information you will need. This is like diagnosing before running test. You know what to look for? If the question asks about contraindicated medications, your eyes automatically hunt for allergies or current medications. You are reading with intent, not wandering. Okay? And please be mindful about this. The next one is mental prioritization, important versus noise. So 50% of the text is irrelevant for the questions. Try to identify that. Ignore hobbies, lifestyle fluff, extra context. You have to focus on what can affect patient care or treatment decisions. Okay? Think of it like prioritization in the ER. You don't treat every minor cut first, right? You treat what's critical. Same with part B. Your brain decides what's life saving information and what's fluff. The next one is about active thinking. It should be greater than the passive reading. So don't just highlight. Try to ask questions while you read. What does this symptom indicate? Could this medication cause a conflict? Is this relevant to a patient's safety? So, all these questions try to ask yourself whenever you're reading the text. So, turn your reading into an investigation, kind of an inquiry. So, you're not a student reading a story, you are a detective, and every word is a clue here. And here is an example. So patient name is Mrs. Thompson, 62 years old. History is type 2 diabetes for 10 years, hypertension for 5 years, osteoarthritis. Current medication is metformin 500 mg twice daily, lisinopril 10 mg once daily, paracetamol 500 mg as needed for knee pain, and allergies, sulfonamides, presenting complaint increasing fatigue over the past week, occasional dizziness when standing, mild knee pain worsening after walking. And the vital signs are BP 145 by 85, HR 78 BPM, blood glucose 14. Additional information patient reports she walks her dog daily and has a diet high in carbohydrates. No recent infection. She is concerned about potential side effects of her medications and asks whether any adjustments are needed. Okay, so here are the question. Question here is the first one. You have to give short answer. Which medication should be avoided? Now remember, you have to go back and check for medications. So we see sulfonamides, that's a red flag. Now you have to look at the current medication like metformin, lisinopril, paracetamol, none or sulfonamide. So they are fine. Now think clinically. If the doctor prescribes a sulfonamide like sulfomethoxazole, that would be unsafe. So the answer is the medication belonging to the sulfonamide class, right? So any sulfonamide medications, because the question is about which medication should be avoided. So try to ignore the distractions like knee pain, walking diet, because none of that affects this answer. You have to focus on allergy plus medication. That's your clinical triage approach. Got it? Now let's move on to the second question. So this one is multiple choice, single answer. Which symptom most likely indicates uncontrolled diabetes? And the options here are mild knee pain, occasional dizziness when standing, increasing fatigue over the past week, walking the dog daily. All right, if you go back to the passage, okay, the case notes, try to identify the key symptoms. Knee pain is due to osteoarthritis. Walking is irrelevant, and the option dizziness is mild, okay? The big clue here is increasing fatigue over the past week. The big clue here is increasing fatigue over the past week. A patient with type 2 diabetes and high blood glucose. So, clinically, fatigue is a common sign of hyperglycemia. So, C is the right option. So, remember, try to combine history with the present compliant plus vitals. That's how you think like a clinician rather than just a student. Now let's move on to our third question, which is matching. So which option will go where? For the first one, fatigue, in context of diabetes and high blood glucose, right? So review blood glucose control will go for fatigue. And if you see the second one, dizziness, that means it was like very postural, mild. Monitor BP advice slow standing. So this should go for the second one. And for knee pain, osteoarthritis, you remember? Provide analgesia as needed. Always connect symptom, history plus context. Don't just memorize actions. Think why that intervention fits the patient scenario. So here are some of the takeaways. Filter noise first, ignore diet, walking, or other irrelevant information. Allergy plus medication, they are the priority red flags. And combine symptoms plus history plus vitals, which gives clues for MCQs and short answers. And try to match questions with reasoning. Try to apply clinical, logical reasoning, not guesswork. And think like a clinician. Try to read with intent, not linearly. And here are some of the summary for this unique approach. So remember about the mindset. Reading, you have to do it like a clinical detective work. And treat text like a patient chart. Try to focus on red flags. Apply informational lenses. You remember, right? The three informational lenses for each question type. And predict before reading. Try to know what you're hunting for. So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye for now.